Good morning. It is 11 o'clock on a Monday, and we're going to start with our daily webinar here at the Hispanic Star platform. Carmen Villar, it's such a pleasure to have you here with us today. Carmen Villar is the VP of Social Business Innovation at Merck. Carmen is a Hispanic Star herself, one, if not the highest Hispanic in the company. And we're going to be hearing from her today about the state of the art of COVID-19. What do we know about the pandemic and what is Merck doing around it? And just as a reminder, what we're doing is we changed the Hispanic Star campaign from the change perception item that we had, and we're going to put that on the fall. We moved it to make Hispanic Stars to be in action, because in this case, we have to react. So we launched the Hispanic Response and Recovery Plan, and we're bringing every day at 11 o'clock webinars. Every Tuesday, we're bringing you COVID updates from across the world, from world experts, talking to our community. We have a marketplace to try to meet those that have and those that need. And we have a list of resources, a catalog of all the resources that you need, from how do I access my credit, health, mental health, how do I cope home, what are the educational tools that I have. We're trying to compile it all so that we can have a one-stop shop. Today, to kick off the week, I want to say thank you all for being here today, particularly our guest, Carmen Villar. Carmen, tell us a little bit about, you're one of my role models. We've worked together for a number of years, Carmen. And you have a very interesting and very pertinent background to have with us in this conversation. Tell us about you. Tell us about your background. To start with, from your origin. You're Hispanic. Sure. in a larger front, and a combination of different identities coming in you.
Yeah. Thank you, Claudia, and thank you, everybody. I'm so grateful to be here with you today in this Hispanic Star platform. I really appreciate the invitation. I think this time is unprecedented in the world of public health, but also in the world of emergency response. There's usually an event or a crisis that we know how to address, and this has been unlike anything we've ever seen before. So I really thank you for this time to chat with you and with the community on this call today, on this webinar. So again, my name is Carmen Villar. My surname before I got married was Hernandez. I grew up in the LA area of California. My mom is of Japanese American descent, or Japanese descent. She was actually born in an internment camp during the war, World War II. So the history of migration on my father's side and the Mexican half goes back to my great grandmother, who rode over with rebels. I think when there really was not a clear land border in Texas. And then on my mother's side, immigrant family from Japan, where my mother was then born in a camp during the war. So a very diverse experience, but not in certain parts of the country. We see similar stories, or stories where families and generations have endured quite a bit, and I think are now facing even more unique challenges in the situation we're in with COVID-19. I also will say that prior to joining Merck in 2017, I spent 20 years professionally working at the Centers for Disease Control and Prevention in Atlanta, Georgia. And a couple things I just want to point out about that is, one, I was really one of the co-leaders in managing our CDC response as it pertained to the 2014 West African Ebola crisis. And, there it was really an amazing experience. It was scary, it was intense, it was challenging, it was all of those things. But what I really took away from that experience was this need for constant communication, meaning sharing what we know based on the science and the data we were seeing, and then acting upon those data as quickly as we could, and then pivoting when we had new data or new information. And so really being agile in that way, much like I think all of us need to do as individuals and communities. And then I want to say what came right after that on the heels of Ebola was a Zika outbreak, where we really saw, especially in Latin America, this impact on pregnant women and their babies, where children were being born with severe microcephaly and very small heads and just unable to function. It was really, really a horrible thing to watch. But what I want to say about that and my learnings around that was really that for the first time at CDC in an emergency response, we had the whole of the government agency coming together, meaning we had geneticists, we had epidemiologists, we had pediatricians, we had OBGYNs, and then we had this whole group that had been working on neglectable tropical diseases and entomologists and experts on malaria and mosquitoes, because that was the vector that was bringing the virus. And my point there is that we need to all be working together to address the crisis that we're in today. Had we not had that diversity of experience and diversity of expertise in this previous outbreak, we wouldn't have known what to do. We would have been, operating with a blindfold on. And we don't want to be in that case now. And I think some would argue that certain sectors we've been that way. But we need the public health people. We need the health people. We need the businesses. We need everybody to come together on this, because this is a challenge, like I said before, that we've never faced.
And that is so valuable, and thank you so much for sharing. Pretty much that's what we know from other crises as well, like the power of communication, the power of being in the same platform and having a coordination mechanism that we need to operate. Pretty much that's what we're trying to do here, bringing Hispanic leaders all together to try to mitigate the impact of COVID in our community and get a together plan of action that is collective. So thank you so much for that. Carmen, tell us about the updates of the pandemic and tell us what Merck is doing to address it. You're working one of the biggest pharma companies in the world. You've seen a number of things. Tell us about COVID. Tell us about the response of Merck.
Yeah. So like many big companies, we're watching this very closely. And I would say that our top three priorities are really around, number one, protecting our staff and their families and making sure that everybody is practicing safe behavior, right? So that we can all be healthy and come back to the workplace and all of that when we need to. I think number two is really around our continuity of supply and clinical trials that we may have in the field, because especially for patients that have already been administered doses or placebos of drugs, we want to make sure that those people are still getting access to any regimen they may have started and that we're monitoring them and taking care of them. The FDA has been very flexible in this regard. There are some areas that have been harder hit where we've had to make adjustments or we've had to stall the initiation of a study, which is unfortunate, but also understandable in the climate that we're in. And then the third thing is really about supporting communities and supporting those in the areas where we work. And I will say that in a few different countries where we are known outside of the US and Canada as MSD, we have worked to make quite large donations, either with non-governmental organizations or others in the community to help to address what's happening in their locality. So that has been inspiring to hear from our country representatives about what they want to do and how they want to participate. And there is an eagerness for this kind of work and this kind of philanthropy. Last week, you may have heard that Merck and Pfizer and Eli Lilly announced this healthcare provider volunteering initiative. So I was just on with one of my staff this morning, who's a physician in New York City. Hadn't practiced for 3 years, but is now reinstating her license and will be volunteering in a New York City hospital. And we have others across the world that are doing that. Another colleague of mine is volunteering and working in the UK, seeing patients. So, we really, everybody from, anywhere in the organization up to the top is really invested in this and really on a personal level, trying to do whatever they can to help. I think you may have also heard a week or so ago that the Bill and Melinda Gates announced a partnership with a lot of private sector partners. We are involved in that partnership and working on the 3 different work stream areas, which include therapeutics, vaccine manufacturing, and then clinical and regulatory issues. So we're very involved on a lot of these specific efforts specific to COVID. And I've mentioned the continuity of our clinical trials. I think on the research front, we are looking at a number of different available antiviral candidates. We are exploring partnerships, and I think we'll have more to say on that very soon. the scientists are eager to do something and to get some of these potential products out there. Now, who knows what that brings, but I will say, because of our experience in finishing the development and then the distribution and licensing of Ervebo, our Ebola vaccine, we do have a lot of experience in this space, and working with partners is one of the key things that we were able to do with the U.S. government, the Canadian government, and a small biologics company, where we were able to bring this vaccine to market and really deploy it in Africa and the DRC with the latest outbreak of Ebola, but also then provide it to healthcare providers and those that are out on the front lines. And I will say, in the clinical and regulatory space, we learned a lot about that experience, where we had an emergency response going on at the same time we were testing this candidate vaccine, which made it really complicated and really interesting to get it eventually licensed on the back end, because things had been done in such a disparate way during the epidemic that we really had to bring all that data together and get it licensed in a way that made sense to people. But we do have that experience to stand on. And then I will say, our supply, we are working hard to maintain our supply of medicines and vaccines, and supply and demand for every product is a little different, but at this time we are currently able to provide a continuous supply of all of our products. We have seen a spike in the request for the Pneumovax vaccine, and we're watching that very closely to ensure that we can continue to supply and or make adjustments as we need to. So I think those are sort of some of the bigger picture things that we're doing. I'm happy to talk about more specific to my unit, my job, which is much more around the corporate responsibility work and philanthropic work. So would you like me to go ahead and do that now, Claudia?
Absolutely, absolutely.
Okay, great. So in my day-to-day work outside of this emergency response scenario, we oversee corporate responsibility, Merck for Mothers, which is our maternal mortality initiative, and we do a lot of work in global population health, addressing social determinants of health, and really trying to work with communities on how we can help to increase access. So those are sort of the big swipes of work that we focus on. And one of the things that's really important in this body of work is patient assistance programs. So we have multiple within the company, and we're really looking to make sure that those programs are shored up so that we haven't seen a huge spike in utilization from patients, but we are starting to get ready in the case that we do see that. A couple different programs we have. One is really to help patients navigate their insurance and what they're able to claim and what they're not. So that would be the Merck Assistance Program. And you can get more information about that one at merckaccessprogram.com if anybody's interested. And then we have a patient assistance program, which is where patients can apply if their doctor is prescribing a drug that perhaps they don't have access to or can't afford, and they can apply for those medications to be donated. And you can get more information about that at merckhelps.com. Sorry, go ahead,
amazing.
Claudia.
No, I just wanted to clarify that, because I think that this is important information for the Hispanic leaders that are listening to this webinar, so that they can distribute that information and we can put that on our platform as part of the resources. So if you're a patient and you're prescribed a medicine but you cannot afford it, you can apply to get the medicine with support. And
yes.
and also if you have like one was for patient and the other one was.
They're both for patients, but one was really, I think, what a lot of patients, and I know this from my own family experience. My grandmother is still alive, and at 93 years old, trying to help her navigate, what her coverage, what her insurance will cover, and so forth, and why are some generics and some not. So there's a Merck Assistance Program, and they really are sort of navigators to help you with your insurance plan. What's covered, what's not, where you can get additional resources or find out more information. So that's sort of that. And when all of those resources have been exhausted, or you don't have insurance, or you meet the sort of economic requirements, you can apply for the Merck, the Patient Assistance Program, and that is at hispanicstar.com, and you can apply for your drugs free of charge. Now, there are criteria you have to meet there too, but if your doctor is prescribing something that they really feel is important to fight whatever it is you're dealing with, and you can't afford it, and you can come to us and you can ask for help. And I will say that in terms of Latino leaders or leaders on this call, for the entire industry, if you go to the pharma website, they also have sort of a clearinghouse of all the different companies and where you can look to get help from them. So those are our patient assistance programs. And like I said, we're not seeing a spike in utilization, but we're getting ready and trying to anticipate whether we do see that and how we will address it. So I wanted to say that as well. And then on the philanthropic side, we've gotten a lot of requests, big or small, for donations, product donations. So we're working with a lot of partners on that. And we've seen a spike not only in the requests, but also in the types of things that people are requesting, right? Some are asking for durable medical equipment. Some are asking for PPE. The company has made donations of about 800,000 masks to the state of New York and to New Jersey. 800,000 in total. And we're trying to triage those as best we can. But with our donation partners, we're also trying to give them a little bit of money, of resources to then manage the increased demand for the distribution that they're facing. So we're working with them on that. We're also addressing at a larger scale some requests that have come in, for example, from the UN Foundation. We've just made a contribution to them to support the WHO in their response to COVID. We've also received requests and are processing a request from the U.S. Centers for Disease Control and Prevention, the foundation, to help support more of the U.S. facing efforts. So we're working on multiple different levels, small, medium, and large, to address requests of donations and money. And then I would sort of want to end with the volunteer services. I mentioned my colleagues earlier, but we have expanded our rules, or sort of our policy around who and how you can volunteer, so that people can really get involved in a hands-on way, that they want to, that they have the skills and the expertise. These are scientists and physicians, and they really want to bring that expertise to fore. So we are working with them and allowing them to do that. But I also just want to bring up that everything counts in this time. And we know this, right? We know that taking care of each other is probably one of the most important things we can do right now. I have somebody on my staff who is making masks and donating them to her local hospital in the Lehigh Valley in Pennsylvania. So I think that this, I mentioned communication earlier, this is one of the most important times to do that. These kinds of venues, and again, thank you for doing this, because this is exactly the kind of venue where we need to share information and be transparent with the information, the data, and the facts that we are hearing about. But then also, I started with my personal story, and I just want to go back to that for a second. I mentioned my 93-year-old grandmother, and she is in the house. She's there with my aunt. But, to not be able to go for a little walk or to see her family, this is a devastating time, right? And this is, I think, at the core and the foundation of who we are as Latinos, is taking care of our family. And so my father every day drives over to her house, and he might bring food or something, but he stands in the driveway and basically has a shouting dialogue with her through her door to make sure that she's okay, and that she has company, and that she's talking and verbalizing and still keeping herself stimulated as an individual, as an intellectual, and really in the way that we can, because he obviously can't go in the house, but trying to take care of those people that are close to him, and those people where he can actually affect a change. And I think whether it's a big business, a small business, an individual, or a family, those are the kinds of things that we need to be doing, and we need to be working together to address.
Yeah, global solidarity. We hear it all the time. Thank you so much, Carmen. I have three. I know that we're about to run out of time, but I have three follow-up questions, if you don't mind. The first one is, and I'm going to say them all so that I can give you the space to respond. The first one is about information and updates. We hear a lot about is there a vaccine coming out? Do we have enough equipment, particularly for those Hispanics that are overexposed and they don't have maybe, coverage for their health? So give us a sense of the update. So we don't want to believe anything on fake news that we see about either vaccines for supply or demand. So if you don't mind, just give us a sense on that. The number two is about Latin America and how,
Sure.
you've been in other pandemics and you have seen how this particular virus operates, and how is it, how is it gonna hit home in the peak, but also go down to Latin America? And I think that the last one is whether you think that, again, we keep on talking about Hispanics being disproportionately affected by COVID. Economically, for sure, we're losing our jobs, particularly the industries that we work on, were particularly affected by losing contracts, by losing jobs, by losing income, but also health-wise, we think, empirically, we're trying to get data about we're disproportionately affected because we're the ones that still working outside, and still on the farming, still, serving a lot. We're therefore disproportionately exposed, and we live in multi-generational households where we can actually be, overly exposed. So if you don't mind, just those 3 points. One is information update. What's really happening with, with the pharma industry, medicine, vaccines, and all that. Number two, Latin America, how is this going to go? How long are we going to be in this one? And then just finish with, with the Hispanic community.
Yeah. So in terms of information on sort of candidate vaccines or therapeutics or things like that, there's not really a whole lot I can share in terms of Merck candidate vaccines. They're, like I said, our scientists are really coming together and trying to look at antivirals that we might have available and think about key partnerships. And like I said, we might be announcing something relatively soon. In terms of a vaccine candidate, I wish I could say something about, a similar case like we were in with Ebola. I can't. We don't have that, at least right now. It doesn't mean that scientists aren't exploring options, and believe me, they're getting restless. They want something, they want to find something, but there isn't anything currently that I can speak to specifically. So let me just say that. There are a lot of companies that are working on this, though, working feverishly on this. And so I'm hoping that we will see some progress on that soon. We have to always stay optimistic on this front. I think in terms of Latin America, we are seeing from watching China and watching what's happening in Italy, and then Germany's been a very unique experience. Watching what's happening and learning from them, I think is critical to how we work in Latin America and the countries there. For example, are we going to see in Wuhan, now that it's opening up again, are we going to see any changes? Are people going to get sick? Is something else going to happen? And I think paying close attention to what's happening in other countries and learning from what they have experienced and what they are experiencing is really, really important. I think that looking to the health systems in a lot of countries, and I mean this with all sincerity, but a lot of the leadership in many countries decide to fly to Europe or to the US when they get sick, right? We can't do that in this outbreak, in this pandemic. So really looking internally to how we address the health system strengthening issues is critical. And so in working with folks like WHO, but also within a country, whether it be Latin America, Africa, or anywhere, how are we helping them to address those system gaps and then making that sustainable over the long term? Because now you're in a situation where everybody has to have access to the same quality care. Otherwise, the populations will be devastated. So this is, I think, a critical opportunity for folks that might have resources or that want to contribute in a way that they can do that to help the health system. And then in terms of the Hispanic communities, this has been one of the hardest things for me personally to deal with. I think whether you're part of the gig economy, whether you're part of an undocumented community, Whatever your situation may be, this is really hard. And what I would say is that we are working with a lot of community-based organizations now, where we're hoping that they can reach more communities at the grassroots level, not only with messaging and information, but with resources where those are needed. And we have, like I said, big level kind of global grants, but also we're looking at smaller partners because we know that that's really where the need is. And so we're doing that, but I think it's also important for us as a Latino community to help people take advantage of some of the things that have been put in place. For example, in some of the states, you know, they're giving relief on having to pay your rent or your mortgage, and you have to obviously provide some documentation and explain why you can't pay. But I think that those are things we need to help people stay educated and informed about, so that if they are really in a financial bind, they can take advantage of some of those benefits. I know there are some small business loans becoming available, and we're talking to the U.S. Chamber about a potential partnership there, where they really want to focus on small businesses as well, because this is where it's really hurting, right? It's a small business person where they maybe have 1 or 2 employees or 3 or 4, and you know, they need to take care of that, but also look at the long term, what's going to happen to their business, the longevity and their economic situation. So we are exploring that partnership further from Merck with the U.S. Chamber, but I know there are a lot of other small business loans out there, and I would encourage all of us to find out more about them and then share that information with people we know who are in need. And then the last thing I would say is all of us as individuals, we can help, right? I've had people that I know that are dropping off groceries. It might not be a lot, but a little bit goes a long way, you know. Put it in a bag, leave it at the doorstep, and text somebody that you've done that so they can come out and get supplies. Helping to just bring that little bit of whatever it is you can do to the doorstep of somebody in need can make a huge difference.
Yeah, and with that, I think that that's what we're hearing again and again, and this is a time for Latinos to be the best Latinos that we can be, support each other. Let's be informed, let's share information, let's share generosity and be one. Carmen Villar, VP Social Business Innovation of Merck, I want to thank you so very much for being with us. I hope that you can be with us, you know, like later as we go along with these webinars and bring more information and share, you know, like an update from your side. I want to finish by saying, yesterday I would love to talk to you and to all of the people that are still in the webinar to say, yesterday I was contacted by someone that has a lot of money that would like to deploy for medical equipment and tools needed for Hispanic concentrated medical centers here in New York. So I hope, Carmen, that we can talk together to see how this clearinghouse of information and action, we can partner on that to provide action and provide resources with, you know, like with to those that need it most. Again, Carmen Villar, thank you so much for being with us. Hope to see you very soon, and thank you all for coming today. See you tomorrow at 11 o'clock for our weekly update on COVID. Thank you, Carmen.
Take care. Thank you so much.
Thank you.
Stay safe.
Bye-bye.